fiscal technical assistance. And what we're going to cover this afternoon is highlights from the governor's proposed fiscal year 17-18 budget. So starting off with kind of an overview there, you can see, and hopefully you all received the PowerPoint that Shoshana sent out. But here you can see the estimated revenues for fiscal year 17-18 for the major revenue sources. And so we'll go through each of these different revenue sources and highlight what the estimates are in the governor's budget, as well as try to give you some guidance on some things to consider as you're developing your budgets for fiscal year 17-18. So starting off with the realignment, 1991 realignment, the structure for 1991 realignment, hopefully most of you know, is primarily sales tax with vehicle license fees. And then there's also a little bit of this vehicle license fee collection amount. And then counties are required, in order to participate in the program, to contribute a very small maintenance of effort locally. In fiscal year 11-12, there was a swap of the formerly state general funded CalWORKS maintenance of effort with the mental health realignment. And at that point, the mental health 1991 realignment actually became funded from a new revenue source in the 2011 realignment and funded with sales tax revenues. The amount that is funded for 1991 realignment through that CalWORKS MOE is a guaranteed amount. And once that amount is recognized, then you start to receive growth, and that began in fiscal year 13-14 in terms of there was sufficient sales tax and vehicle license fees so that there is growth attributable to the 1991 mental health realignment. And then in addition to that, mental health also receives 5% of the annual growth in the 2011 realignment support services account, and that comes across once a year. And again, it's just based on 5% of the growth in the support services account. In terms of how funds are distributed, they are distributed to you folks on a monthly basis based on the actual sales tax revenues received, with the one exception being that the mental health amount in the mental health account is a fixed guaranteed amount, and so you get that every month guaranteed. There's then the mental health sales tax base and the vehicle license fee base, which are funded after the CalWORKS MOE has been fully funded. So at this point, you don't receive those funds until very, very late in the fiscal year. And then there's mental health VLF collections, which is fixed at $14 million a year. Years in which there is growth, the revenues above these base amounts then go into growth accounts, and there's separate growth accounts for sales tax and for vehicle license fees. The growth in those two accounts is distributed according to a formula, and it's different for sales tax versus vehicle license fees. For sales tax, the increase in social services caseload costs are the first priority for any sales tax growth. And then if there are any funds remaining, those then go to the three programs that are funded in the realignment. Now, the one thing that occurred this year as part of the governor's budget is that the Department of Finance indicated that they're going to discontinue the coordinated care initiative because it was not cost effective. And so every year the Department of Finance, or the director of the Department of Finance, evaluates the coordinated care initiative to see if it is cost effective. And if it is not, then it ceases to exist. the following year. So since the director of the Department of Finance said it's not cost effective, that coordinated care initiative will will stop existing on December 31st, 2017. Now, what that sounds like it means is that a lot of costs that were funded through managed care plans and various other sources that were funding some of the in-home supportive services, those costs are now going to be borne by the counties. And the counties have estimated that that is about an increase of $625 million in fiscal year 17-18 alone. So quite a big increase. How this then plays out in terms of the 1991 realignment is that, like I said, sales tax growth first has to cover the increase in costs in social services caseload costs. Well, in this case, for 17-18, the state's estimating about $83 million in sales tax growth. Well, that clearly is not going to fully cover the $625 million that may be necessary for the increase in caseload costs. So if this proposal plays out the way that it's been discussed, it's highly unlikely there will be growth in sales tax revenues for the 1991 mental health realignment account, because there will be caseload costs that will chew up most of the growth, will chew up all of the growth into the foreseeable future. This should not impact your sales tax base or the fixed amount of mental health funds that you receive in 91 realignment, but it will impact growth. The other thing is this will not impact the VLF growth, because that goes to all three programs separately than the sales tax growth. So it's interesting in the way it was presented in the budget, in that the realignment pages did not reflect this huge increase in caseload costs. So I don't know if the administration is anticipating some sort of compromise or some sort of negotiation where they're going to kick in more money to cover this increased caseload costs. But on the surface, it looks like there will not be any growth beginning in 17-18 for 1991 mental health realignment sales tax. Fortunately, there is, like I said, growth in VLF, and that will go to the three programs. And growth is distributed the year after it is collected. So in other words, you don't know the growth until we're into the next fiscal year. We're like November or so of the next fiscal year. So looking at what the figures look like from the governor's budget, and I'm again pointing out that I don't think the realignment pages reflect the anticipated increase in caseload costs. I think the state just went along with the presumed normal social service caseload costs when they projected this growth in 17-18. Because again, if the increase in caseload costs as a result of the coordinated care initiative, there won't be any sales tax growth. So I don't know why the state would have presented that. But on the plus side, again, vehicle license fees are going up, and so we are seeing some growth there. And again, the way this works is that you have the base plus then the growth becomes the base then for the next year. And again, that's for the sales tax and the vehicle license fee base. There's the fixed amount, the CalWORKS MOE swap, and then the fixed amount of the vehicle license fee collections, and then again the small amount that comes across as the 5% of the support services accounts. So in terms of just some thoughts on how to look at budgeting for this, again, for the current year, for 16-17, Again, we've got 4 different accounts or sub-accounts that are part of this 91 mental health realignment. The mental health part, per the State Controller's Office website, that will continue to be funded at a fixed amount per month. That should not change. But remember too, out of the fixed amount, they're also offsetting for managed care and state hospital offsets. So those are deducted to get to your net amount, but the gross amount is fixed. The mental health sales tax base, again, there was no growth in 15-16, so that is staying at the 33.9 million. But again, you won't see that money until probably towards the very end of the fiscal year, because they're going to make sure and fund the CalWorks MOE swap first. And the same with the VLF base. That will be funded up to 94.9 million at the end of the fiscal year. The VLF collection you've already received, and so this is giving you total base funding of about almost 1.3 billion, a little over 1.2 billion dollars for the current year. In addition, you received cash from 15-16. You received the distribution in the growth funds. There was no growth in sales tax because the caseload costs in social services actually exceeded the total growth in the mental health, in the sales tax growth fund, or the amount of money in the sales tax growth fund. So there was no additional funds that were distributed in terms of sales tax growth. VLF was actually pretty strong. That was 46.1 million, and you received that back in December. And then again, the 5% of the support services growth account was 6.7 million, and that was distributed in October. In terms of the budget year, so looking at 17-18, I'd continue to budget the mental health amount at that fixed amount. That shouldn't change. The mental health sales tax base, again, since there wasn't any growth, I would just, well, actually, since we don't know the 16-17 growth, I would budget that at this point. I would budget it at the same amount as the current year. Same with the VLF base, budget that at 94.9 million a year, and budget the VLF collection at 14 million a year. And so that give you that recommended budget funding of the 1.263 billion dollars. I then would wait until November when we know how much growth there is in 16-17, and I would then do a mid-year budget revision if you have that option available to you. The growth that is projected, and this is actually an error in the slides that I sent out to you folks. I should have had 38.4 million in the mental health sales tax base, not 0, because there should be a little bit of growth in 16-17 plus the base amount, so that your 17-18 sales tax base should be about 38.4 million. The mental health VLF base of 119.2 million, and then 5% of the support services account of 7.3 million. And again, the impact of the increase in social services caseload costs due to discontinuance of the coordinated care initiative, that won't take effect until you start to look at 17-18 growth. And so at that point, this would probably be the last time we'd ever see any growth in mental health sales tax if without some sort of additional agreements around the discontinuance of that program. So I'm going to stop here and just go ahead and take some questions. Shoshana, I don't know if folks can raise hands.
Yeah, there is one question, and I neglected to say at the beginning, please just type your questions into the chat box or raise your hand. Click on the hand button next to your name so that we can monitor the questions. So right now the question is, if we were to see a recession, could our flexible portions of the 91 base level reduce, or is the base amount a floor?
So both the mental health sales tax base and the mental health VLF base will go down proportionally if revenues don't come in. The fixed amount, the mental health part, is guaranteed, and so it would take a very significant, I mean, I don't even know how much of a recession would have to occur for us not to get the mental health portion. That $1.12 billion is guaranteed. But the mental health sales tax base and the mental health VLF base could, if we went into a recession and there was a decline in the amount of sales tax and vehicle license fee revenues collected, then yes, those would go down. And the downside to this is that you wouldn't really know it till the very end of the year. Now, you could be tracking how the CalWORKs MOE is getting funded, and especially relative to a prior year, to find out if that is a potential occurrence. And but otherwise, yeah, you wouldn't even know till the very end of the year, where all of a sudden, instead of $33.9 million for sales tax, it would potentially come in less. So those are not guaranteed. But the $1.12 billion that we call mental health is guaranteed.
Okay. There's another question. How many years prior to 2011 realignment did mental health actually receive 1991 realignment sales tax growth? Is there a chart that shows these amounts over the years?
You'd have to, I don't know of any charts. The state controller's office used to put out a report, and you could track those reports, but I don't even think they're available electronically to see which years there was growth in sales tax or VLF. But that would be the best source for something like that. There were many years that we did not receive any growth, especially in sales tax, because of social services caseload costs. And in fact, it's been brought up that when you look at your three major funding sources outside of the FFP, when you look at 91 realignment, 2011 realignment, and the NHSA, and those all generally fund different aspects of your community mental health programs, but the growth in those is very different. And so with probably 91 realignment receiving the least amount of growth, and again into the foreseeable future, but even historically. And so since a lot of the 91 mental health realignment goes to fund a lot of your involuntary LPS type stuff, state hospitals, things like that, the adult population, it tends to, again, disadvantage that population in terms of receiving services, because you're not receiving any growth in those revenues, versus the 2011 realignment, the kids Medi-Cal, through that you're getting more money, and then NHSA, which fluctuates like crazy, but in general it's been an upward trend, and so the folks that are in your NHSA programs end up receiving more services. So kind of a long answer, but the bottom line is you'd probably have to contact the state controller's office. I doubt CBHDA has something like that, but they might, to look at the actual growth.
Well, that question came from Kirsten, so probably not.
Yep. Okay.
Okay, another question from Kirsten. If the IHSS proposal goes through and counties stop receiving 1991 realignment sales tax growth, what services are the counties currently funding with those dollars, which could be lost if the IHSS proposal goes through?
So again, the IHSS proposal will just discontinue growth. So you're still going to get the majority of your funding in the 91 account. I didn't see, in fact, I don't think they could take away your base funding, but it's the involuntary stuff, it's the LPS stuff. That's what you generally would use your 91 realignment to cover, and so that's what's going to be impacted. It's not going to be able to grow. You're going to have to try to, with MHSA, integrate as much as possible into your MHSA plans, as well as, with the behavioral health sub-account on 2011, just try to keep folks on Medi-Cal, because then you can use it for the Medi-Cal services. But it's going to be the non-Medi-Cal folks and the involuntary type services that are impacted from a lack of growth in the 91 realignment. All right, anything else? Is that it for questions?
Yeah.
Okay, moving into the 2011 realignment. Again, this occurred as part of the Fiscal Year 11-12 state budget, and carved out a specific portion of the sales tax to fund these services that were previously funded with state general fund monies, which are your Medi-Cal specialty mental health EPSDT services, your Medi-Cal specialty mental health managed care allocation, and then all the SUD services, drug Medi-Cal, drug court, and non-drug Medi-Cal. And then the one thing worth noting is that MHSA funds were used in 11-12 to fund these services on the mental health side. So in terms of what the budget's projecting for revenues, you can see here they are projecting, so they're projecting some new growth. It's not as much as we received in 14-15, but it is still a decent amount of growth. You'll also notice too that I don't have it broken out by program like we used to, or how I used to display it, because it is your discretion on how much you want to spend on each program, how much you want to dedicate for kids Medi-Cal services, or for the Medi-Cal managed care program, for drug Medi-Cal, for the non-drug Medi-Cal, and for the drug courts. But you can see here, based on sales tax projections, it's a decent amount of growth, 6-7% a year for the next couple of years. Again, one downside with this is that the growth doesn't come out as quickly as growth in 91 realignment. I know CBHCA is working with CSAC and with the state on trying to get this to be a much more timely distribution and move more towards a rolling base similar to the 91 realignment, so that those growth funds aren't sitting at the state. So for example, right now the $67 million in 15-16 growth is sitting at the state. So in terms of looking at what to budget, you're going to receive, unless sales tax declines, you're going to get funded up to the 16-17 base amount of $1.2 billion. The individual county allocations are based on the information notice there, 16-052, which basically looked at a bunch of different data points. It looked at your 13-14 EPSDT approved claims, your 13-14 drug Medi-Cal approved claims with a $100,000 minimum if you were below that amount, and then historical amounts for managed care, non-drug Medi-Cal, and drug court allocations to come up with what they called a target amount. They then put out the rest of the money based on the number of Medi-Cal beneficiaries in each county. And then there was also a hold harmless provision so that no county was reduced more than 15% in 16-17 over what they received in 15-16. But the downside was the information notice itself was calculated based on a projection from the May budget revise that actually overstated the amount of the 16-17 base amount. So you can see there the difference between the two numbers. It's like 38 million. The amount, the dollar amount in the information notice, you will not receive. You will receive that percentage amount applied against the 1.230 amount, which is the true 1617 base amount. And so that's what you should receive for 1617. I haven't heard that the state is going to revise the percentages and revise the calculations with the correct base number. So I would just at this point assume you're going to get that same percentage just applied against the lower base. And then again, don't forget that there will be 67 million hopefully coming out at some point this year. So for the budget year, I'd probably keep it. I'd budget the same amount as what you have in your current budget. And again, this whole rolling base thing, 17-18 should reflect a rolling base, which should take the 16-17 allocation plus the 16-17 growth to come up with that rolling base. But at this point, we don't know how much the 16-17 growth is going to be. I wouldn't budget for it. And given some of the timing on some of the data points, I'm not sure how it's actually going to play out in terms of a rolling base. And then also the fact that the state published a base amount that exceeded what the true base is, I'm not sure how that's going to play into it either. So that's what I would budget at this point for 17-18. And then I think once the actual 16-17 growth is known, I would again do a budget revision to my 17-18 number to bring it up to the 17-18 revised base. Any questions on 2011?
There's a couple of questions. The 1/11/17 CBHDA memo on the governor's budget shows 1308.5 million for 2011 behavioral health sub-account base, but slide 10 shows 1303.4 million. Any idea why your number is lower?
Yeah, so the way it's presented in the governor's budget, so there's, in addition to the amount of money that goes to you guys, there's also this woman and children's residential treatment services that's fixed at 5.1 million a year. I don't include that when I show my stuff because that's only like 5 or 10 counties, I think, that receive that amount. So what CBHDA has is correct, and that is the total amount, but you couldn't apply those percentages in that information notice against that total amount to figure out how much you're going to get, because 5.1 million is a fixed amount that goes to specific counties. So I back it out, and so I can tell you that use the number that I'm showing times those percentages, and that's what you should receive.
Okay. I've heard that the governor's office made a $1.5 billion error in their budget. Do these slides account for the correction of that error?
I'm not aware of a $1.5 billion error on the behavioral health sub-account. The growth in sales tax revenues that they're using are right around 3%. So I don't know how, which seems reasonable. I mean, that's consistent with what they've used on other things. So I'm not sure of where this $1.5 billion error is that's being referenced. But again, what is shown in the governor's budget, both for the 2011 and the 91, both seem fairly reasonable to me. You're looking at 2 to 4% increase in sales tax and VLF over what was collected last year. So that, given the economy continues to grow, that seems pretty reasonable. So I'm not sure. So again, I don't know where the 1.5 billion is, but I don't think it is impacting this side of the house.
Another question. Counties receive the 14-15 growth dollars, but there are no schedules showing how the growth distribution was calculated. Do you know when these schedules will be available?
I have no idea. I would think the DHCS would publish something at some point, but I have no idea. And also, other than I believe there was a letter from Department of Finance that accompanied the growth schedule. I don't have any other details on the 14-15 and how it was distributed.
For the 2011 base, given a recession, what is the allocation floor? Is it the original legislation base amounts, or is it the new base that was just created?
So again, if you're funded, it's kind of like the way to look at it is the way that even that information notice was published. Even though the number, so they showed you a dollar amount in that information notice that was based on $1,268,000,000. Well, really the base is only $1,230,000,000, $1,230,000,000. So, and if the sales tax revenues don't come in to hit that 1.230 number, you'll just get that allocation percentage that is shown as the percentage for you applied to whatever revenues come in. So, and there is no floor. I mean, if you know sales tax went away and there was zero revenues, you get zero revenues. The only one again that's guaranteed is the 1.12 billion of 91 revenue. Everything else is purely based on what is received, you know, in the state coffers in terms of sales tax and vehicle license fees. And when we talk about 2011, it is it's sales tax revenues. So if they ever fell, and they did, I forget what the percentage was. I want to say over the 2-year period, like 2008, somewhere around there, 2007, 2008, it fell like 20%. So sales tax could fall, and you could see a decrease in your revenue of 20%, and it would be proportionate to each county, because again, those percentages that are shown in the info notice are applied against whatever revenues are received into the fund. But there is no floor. There's no guaranteed amount in the 2011 numbers. But the thought is that, you know, that there's always going to be sales tax of some sort. So.
One last question. 1617 total base on the slide is 1230.3. The HPS info notice total is 1268.6. Did you say to plan on our percentage of the lower number?
Yes, the lower number, because again, so the number in the information notice was based on a projection that was in the May revise. The 1,230,000,000 number is what was actually received, and that is your base, the total base for the current fiscal year. And you know, I guess the state had to do what they had to do to try to get the info notice out and to get those percentages in place. But the problem is that sales tax, what actually came in, especially the last couple months of the year, was a lot less than what the state had estimated. So that the real base number, and you can find this on the State Controller's Office website, is 1,230,000,000. That it on questions?
That's it for now.
Okay. So MHSA, you know, it's a tax on the millionaires. Very few folks, very volatile, revenue stream. And you've got the two sources of deposits. You've got the monthly personal income tax payments, which are basically like an advance into the fund, and it's 1.76% of all personal income tax payments into the state. And then there's an annual adjustment that settles up this monthly amount to what was actually earned, and it lags by 2 years based on actual tax returns. The amount of money that you receive is based on the unspent and unreserved funds that are in the State Mental Health Service Fund at the end of the prior month. And you're going to see that in terms of cash flow, the cash transfers themselves, so the monthly amount, those are largest in months or in the next month after there are estimated tax payments. So in January, April, June, and September, folks pay estimated taxes, and so then the subsequent month you're going to see potentially a little bit higher of a distribution. The annual adjustments are incredibly volatile. They lag by a couple of years based on the actual settling up to the actual tax returns that are filed. It's known by March 15th what will be deposited on July 1st. So, by the middle of March, we'll know what that annual adjustment is for fiscal year 17-18. And so that is also what causes your August distribution to be so high, is when there's a very large annual adjustment. It causes the distribution amount for August to be significantly higher. So in terms of the estimated revenues on a cash basis, you can kind of see it there. Current year is estimated to be pretty significant of an increase over last year. Last year was really low, and again, if you look at the annual adjustment for last year, was $94.3 million, while we had almost $480 million the prior year, $464 million in this year. So that's what caused last year to be so low. Projecting a little bit less going forward in terms of the annual adjustments, and just kind of a basic, constant little bit of growth in the personal income tax payments that come across through the cash transfers. So that's the revenues into the fund. What actually comes out to you folks are kind of these bottom line figures down here. Again, seeing a fairly large increase in the current year, and basically staying flat, maybe a little bit of a decline over the next couple of years. The No Place Like Home bond and the debt service associated with that is backed out of these figures, so this takes that into account. But to be honest with you, that doesn't really fully ramp up for quite a while, so it's not that big of an impact at this point. So in terms of looking at what I would kind of say to budget for this stuff, the current year, the 30% increase over 15-16, again, because the annual adjustment is known, it's already been distributed to you folks, it's a pretty good shot that you're going to get most of that money. So it's, like I said, a pretty good shot that you're going to get that amount of funding. You could be a little bit conservative, but I wouldn't go dramatically conservative. You're going to want to look at the county distribution percentages that are shown in Information Notice 16-040. The state has started recalculating the distribution percentages every year based on updated, primarily population statistics. So, what would I look at for next year? I probably would anticipate a slight decrease over the current year. And again, we'll know more once that annual adjustment amount is published in a little over a month, when the Department of Finance informs the legislature and everybody else what that amount is. You can look at it relative to the amount that was there for the current year, and it'll give you a sense of is it going to be a good year, a little bit less, where are we going to fall? The downside is, since the state has started basically recalculating the entire distribution formula every year, it's tough to tell you what to use for an allocation percentage for 17-18. I think the best that you could do at this point is to use the current percentage, but know that that may differ a little bit if the state continues its past practice of changing those percentages. Any questions on MHSA?
Why have they already taken the reserves for No Place Like Home if they're not going to use it right away?
So that's why there is no impact really of the No Place Like Home. It's super minimal. There aren't that many dollars that are getting taken out of the Mental Health Services Act fund for the debt service yet. I mean, it's, like I said, it's really minimal.
She says, I believe there was $6 million reserved.
Yeah, so again, that's nothing compared to, what is it, the $130 million once all the bonds are issued. So it's just not very much. I mean, and some of that could even be, although I don't want to say it, it even could be infrastructure costs. For example, hiring the firms to issue the debt service, to do all the pro formas and everything else that goes along with issuing the debt service. But yeah, it's really, really minimal compared to when we get out, 4 years from now or 5 years, whatever it is, and it's $130 million in debt service, and that will be, I forget if it's 20 or 30 years that'll be going on and being taken out of the Mental Health Services Fund prior to distributions to you folks.
I think you already answered this, but when can we expect to see the full effect of No Place Like Home?
I don't know off the top of my head, but it's like 4 or 5 years, and it ramps up, each year, and it also is going to depend on where the projects are in terms of I don't think they're going to be issuing the bonds until they actually have, what is it, they're ready to start projects, and so if that's delayed, or if it takes a while to get up and going, it could delay the issuance of the bonds longer. But I want to say, I want to maybe 4 or 5 years out, 5 or 6, something like that. But the other thing, if you look at the volatility of the annual adjustment, where it swings $300 to $400 million a year, that's far outweighs the amount of money that is going to fund the debt service for the No Place Like Home. So it's as long as the economy continues to keep going along, we'll be okay. But more than likely, what's going to happen is we will go into a recession, and then the No Place Like Home will hit, and we'll have revenues down quite a bit, which is why you guys should all have reserves set up, either in the form of the prudent reserve or the some amount of unspent funds on hand to cover when we will have a decline, because we will at some point. All right, anything else? Are we good on that?
Yep, we're good on that.
All right, Medi-Cal, especially mental health reimbursement. So this is your FFP, your federal financial participation, which you receive based on your actual certified public expenditures, or CPE. And so you get this interim amount throughout the fiscal year based on the approved services and your interim billing rates. For contract providers, that should be the amount that you're paying the contract providers. For county-operated providers, you're trying to approximate actual costs, but the state has put these county maximum rates in place that you cannot exceed for county-operated services which is based on your most recent filed cost report adjusted for inflation. These interim amounts are then reconciled to your actual expenditures through the year-end cost report settlement process, which a lot of you just went through it. Well, not the settlement process, but at least you filed it, hopefully, last month. And then what's supposed to happen is basically 18 months after filing, the state should have already done the reconciliation. And they would have worked with you to figure out the reconciliation, whether you owe them or they owe you. So technically, they should be settling fiscal year 14-15 right now, but I believe they're only on 10-11 or 11-12. And I would guess it's because of lots of glitches with the short dwell claims processing system. So, and then that settled cost report, they go through, and within 3 years, they're required to audit you or do a desk audit to determine your final Medi-Cal entitlement. So again, they should be auditing 11-12 at this point, but they are several years behind. Again, primarily due to, I think, the reconciliation process being behind. So not quite up to date on the Medi-Cal stuff. Any questions on the Medi-Cal? Then we have, there's a little bit of state general fund monies, more than there has been in the recent past for mental health services, and you can see the amounts there for different programs. The continuum of care reform, the PSDT performance outcome system, implementation of managed care regulations, and then the special terms and conditions associated with the mental health plan. And if you want more detail on that, I would say take a look at the CBHDA budget memo that describes each of those different programs. So then we put it all together, and it's, it's a little bit of growth here, especially in the current year, and then also in the budget year, not huge amounts. But again, given the increased expectations and increased responsibilities that are continually put on you folks, it's not a huge amount of money of growth to be able to do that. So, but at least it's not negative at this point. And the last thing I hadn't done this, I don't think, with you folks before, but to give you, if you weren't aware of some of these websites, where to find the State Controller's Office allocation schedules for all the 91 realignment stuff, or for the 2011 realignment, or NHSA. You can go onto their website and look at the allocation schedules. The Department of Finance puts out a monthly finance bulletin, and the one thing there, you can kind of get a sense of how MHSA is coming in relative to what was budgeted. And so it'll say the amount transferred was X dollars, which is either higher or lower, and they'll tell you the amount. And then there's a couple of DHCS links on MHP information and on MHSA information. So, so we're a couple minutes early. Any questions?
There's a couple of questions.
Okay.
Do you expect any effect from the elimination or change to ACA this year or future years? That's a big one.
Yeah, I mean, it really depends on what. Well, first of all, is there a replacement? Is it going to be something where, well, the whole Medicaid program, I mean, if it ends up being a block grant, that's a whole different discussion than looking at CPE type of reimbursement. It doesn't seem like anything is going to happen, at least this year, I don't think. I think it would just be too quick. So you could potentially see the mandate go away, but I don't know if they would discontinue the funding of the Medicaid portion of the program this soon. But yeah, I mean, who knows? I mean, whether they just repeal it, whether they replace it, whether probably. So every time there's been a change in administration to a Republican administration, we always entertain the thought of the Medicaid program becoming a block grant, and it's never happened to date. But clearly, this time's a little different than other Republican administrations. So who knows? But again, keep keep getting your claims in, doing your cost reports, all that stuff, because we're so retrospective in terms of reimbursement. We're going to be doing it a while, I think, even if there are changes coming down the pike.
Couple more questions. The governor's budget summary says beginning in 2017, the state assumes a 5% share of cost for the optional expansion population. The budget assumes costs of $20.1 billion. What does this mean?
So that would be 5%. So I believe that I would imagine that you folks are going to have to start contributing funds towards the ACA folks, because remember that started at 100%, but it phases down to 95%, assuming that the Medicaid program stays and ACA stays the way it's written. So you're going to have to come up, I would imagine, with that local match. I guess hypothetically the state could come up with that and give you state general fund monies, but I think it's highly unlikely. I did look at the amount that the state had budgeted for mental health ACA, and I want to say it was around $500 million. So if you're going to have to cover 5% of that, that's about $25 million. And so what you're going to want to start to do is look at, just don't anticipate receiving 100% reimbursement on those ACA folks. You're going to have to kick in a 5% match, no different than like a non-ACA Medi-Cal client where you've got to kick in 50% match, either with behavioral health subaccount, 91 realignment, or MHSA, or a mixture of them. But it's not. I think you're going to see. It's not a huge amount, and I think you would see a larger impact with somehow if the ACA is dismantled or block granted or something like that.
Follow up. What is the $888 million of SFG for?
What was the question, Shoshana?
What is the $888 million of SFG?
State General Fund?
Oh, maybe it's supposed to be SGF. Yeah, probably.
880 million? I guess I'm not seeing what they're referring to. Is there a specific slide?
Wait for her to respond. It's related to the share of costs. The budget assumes costs of $20.1 billion, $888 million general fund.
So you must be looking at the overall Medi-Cal budget, which for most of the services is a combination of state general fund and federal reimbursements. So we're different in that you guys have the local funds, that's the CPE. unless, like I said, if the state's anticipating they're going to give you, the match for the 5%, which maybe they will, but again, it's $25 million on a $7.2 billion system. It's important, but it's not huge.
Okay, one last question. I understand there are a few small allocations that behavioral health is supposed to receive for CCR. Do you know when that will be allocated to the counties?
I do not know when, and you can see here it's $14.7 million in the current year, $13 million in the budget year. I have no idea how any of these allocations are going out to the counties, and how each county's individual amount is known, nor on the timing of when they're going to put this money out to counties. I would assume they're working with CBHDA and your Financial Services Committee and your FARs to come up with approaches that are acceptable to everybody. But I mean, we all know how long it often takes the state to put something together. Kind of like when we saw the 600,000 in KDA progress report stuff seemed to take forever to get out. So, so bottom line, I don't know. I don't know when or how much is going to go to each county or what the criteria will be.
All right, that's the end of the questions.
Okay, we're a little bit over. All right. Well,
all right. Well, thank you, everyone. This webinar was recorded, so in the next few days we will be uploading it to our website in case you want to watch it again or forward it to any of your colleagues. If you have any other questions, feel free to email me and I'll get them to Mike.
All right.
Thank you, everyone.
Thank you. Bye-bye.
Bye.